Good afternoon, and welcome to this important session, Living with ALS, Sexuality and Intimacy. I'm Sue Zimmerman, Care Manager at the ALS Association Greater New York Chapter. Sexuality and intimacy can be problematic at times in any relationship, but can be more complex if a couple's relationship as partners becomes one primarily of caregiver and patient. I'm very pleased to introduce our presenters, Joya Ciani and Shara Holzberg, both experts in the field of ALS. Joya has 12 years of experience as an occupational therapist on the multidisciplinary teams of the certified ALS centers at Mount Sinai Beth Israel Medical Center and the Hospital for Special Surgery. She is also the program director of the Occupational Therapy Program at Hofstra University. Shara is the manager of the Clinical Neuromuscular Research and the Speech-Language Pathologist on the Multidisciplinary Health Team at the Hospital for Special Surgery, ALS Center. There will be time for questions and answers at the end, so please enter your questions or comments directly into the Zoom question and answer box. Thank you, Joya and Shara, for sharing your special expertise with us. Please begin whenever you're ready.
Thanks, Sue.
Okay, well, thank you, Sue, for such a nice introduction. Hi, everybody. Thank you for attending our presentation today. I'm Joya Ciani. It's so nice to be with you all. Shara, our co-presenter for today, and I work at the Multidisciplinary ALS Center at the Hospital for Special Surgeries in New York City. We're gonna present some information on sex today and implications that having ALS can affect your own and your partner's sex or sexuality. Shara and I are going to be going through this presentation together with you, alternating between different topics. We hope that we create for you all a safe and comfortable environment. We invite discussion and participation. So please feel free to share your own perspectives and your own experiences if you wish. So let's get on with it. Why talk about sex? Well, we know that a satisfying sex life makes us all feel good. We know sex helps to improve health and well-being overall. Benefits to having sex include increases in heart health, increases in mental health, pain relief, and happier relationships. Having a good sex life can bring us pleasure, stress relief. We engage in sex because of attractions, the need to bond to someone, to feel close, and for escape. Sex activates a variety of neurotransmitters that impact not only our brains, but several other organs in our bodies. And there's tons of evidence that support the connection between well-being, quality of life, and sexuality. And evidence that shows that a satisfying sex life improves health and well-being, and that sexual activity is associated with greater enjoyment of life overall. Shara and I became very interested in exploring this topic after we were working with a person with ALS who wanted to talk to us about some of her issues revolving around having sex. And the experience with the patient at that point resulted in many discussions between Shara and I and the team, and other patients and other teams across the Northeast. And ultimately led us to develop this presentation. We have a quote from a person with ALS who says this: "I think these topics are important because closeness is something we crave as humans. Open dialogue is paramount in these situations. I'm not sure people can have these conversations without assistance from a professional." So I'd like to turn this over to Shara now.
Thanks, Joya. So, as Joya said, this was an interest of ours. It still is an interest of ours, and we still do try to address this with our clinic patients. But first, trying to kind of see where everybody here stands with this is we really want to know, and there will be a poll that you can respond to. We would like to know if you feel that ALS has impacted your sexual activity. So the choices are yes, A, and B, no. A couple seconds for people to answer. All right, and are we able to see, sorry, are we able to see that result? Okay, good. So we have a, we can show those results. We have 83% of you said yes, which is kind of what we had thought, which led to our research in this area, which we will get to the details of that a little bit later. But so the next question, the follow-up to that on our next slide is a little bit more detail about what we are, what we are considering sexual activity. So what we described it as kissing, touching, cuddling, oral sex, masturbation, intercourse, and any other activities that you could think of that we left off the list. So again, we have another poll for you, and we're just interested in hearing if you feel that ALS has impacted your ability to engage in any of those activities. And you can choose more than one.
And Shara, this is all anonymous, isn't it?
Yes, yes. We actually are adjusting a number. So
feel free.
Feel free to be honest. We encourage honesty. Thank you, Joya, for that. I'll wait a few more seconds and see if we can pull up results. All right, so there's we can share these if that's possible. Everything was checked off, which again is not far from what we expected answers to be. This is what we thought when we were going into this and we were having our conversations. It's the feedback that we got from some of our patients, and these are the terms that we used to kind of as a jumping off point is what we thought was intimacy and sexuality. And some of the there are higher numbers for some of these things that we would expect to see, but I do find it interesting, and I don't know, Joy, if you have a different opinion, because we asked different people, but everything has a significant percentage. So thank you all for being honest and participating, and hopefully some of what we talk about next will help answer some questions or maybe give you some suggestions on ways that we can kind of work around this, because as Joya said, this is really important to all of our well-being. So
yeah, I'm interested in G, any other activities. So maybe
yeah, that's where the chat comes into play, guys.
Yeah. So, but we can have further discussions as we go on.
So
I'm having problems advancing. Here we go.
Oh,
so this is just a boring slide, but we felt it was important to show you that from our early experience working with that particular patient that we spoke about earlier, and then going on this deep dive into exploring the topic further, we found that there are lots of folks with ALS and their partners who have lots of questions about sex, as we saw on the two polls that we just got some information from you guys. And we found that the experiences of people with motor neuron disease and their partners are rarely reported on in research on sexuality. So there's lots of good research on this topic with people with like Parkinson's disease or stroke, multiple sclerosis, breast cancer, older adults, adults with dementia, but not so much with people with ALS and their partners. And we know, and you guys know, that ALS is a disease that is very different from some of the others. Yeah, sure, there are similarities, but ALS is unto itself very specific, and that pals and their partners have different concerns from some of those other groups of people. The literal research that there is considers sexuality in this population, and found that sexual expression remains important even when there is extensive disability. So in 2017, our team at HSS published this article in the journal called Neurorehabilitations. And the title of the article was Perceptions of Sexuality in Individuals with ALS and Their Treating Clinicians. And this study really, we looked to explore the perspectives of people with ALS and their treating clinicians regarding the importance of talking about sexuality in a setting such as in a multidisciplinary setting during clinic visits. What we found is that the majority of participants, 58%, reported that either they were sexually active or no longer active, or they were currently sexually active, but that overall things really had changed for them and for their partners. And we also know from our study that patients, as well as healthcare professionals on the teams, are just not comfortable talking about topics related to sex and sexuality. We know from our study results that 82% of our participants reported that no healthcare professional ever addressed these issues with them or to talk about sex or sexuality, but that 56% of all of the participants felt like topics revolving, or at least a topic, how are you doing? How's things regarding your sex or sexuality? How's your sex life? That those kinds of questions really should be brought up during a team or a clinic visit.
And a note to Joya to that, just before you move on for 1 second. What we also found was that it wasn't a specific person. I don't think we have anything on the slide here. It wasn't that it was a specific person on the study. I'm sorry, on the clinic team that people talk to is really just whoever you had that connection with, which kind of from the flip side of for us as the clinicians, it's kind of hard sometimes to gauge who should be the person to talk about it. So there was a counterpart to that did talk about this topic with the professional side of it. But to Joy's point, everybody had the same thoughts. It should be addressed, and it's not addressed enough. So just wanted to add by 2 cents.
Yeah, and maybe just bringing up the topic. Certainly, no one has to answer it, and you don't have to discuss or disclose at any point. But sometimes just being asked sort of opens the door for the dialogue. And there are strategies which we'll talk about later on that many of the team members can actually bring to the table and sort of, for points of discussion and as a support for either the person with ALS or their partner.
And so hopefully this presentation kind of for you guys who are, tuned in with us, maybe this is just enough to let you know, like, okay, it is a safe place to go to bring it up with my team if you didn't feel it before. So.
Yeah, so we know that sexuality and intimacy are often put on hold after a diagnosis. That's understandable for sure. And many people react differently, but there does come a point in time when many people with ALS, and certainly their partners as well, want to reconnect or resume that more intimate relationship. And science says that ALS doesn't directly affect sexual function. However, we know that sexual intimacy and romance are certainly affected. So ALS may affect your relationships, may affect your sexuality, may affect your sexual activity, but does it really have to? I'm just going to define some terms for you. And just to say, first and foremost, any sexual activity that's out of sight and sound of any unwilling observer, but that is mutually agreed upon by all partners that are engaging, and that is not harmful or coerced in any way, and is among consenting adults, should be considered normal. So sexuality encompasses sex, gender identities and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. And that's the definition of sexuality from the World Health Organization. Intimacy and physical and emotional closeness and connectiveness, mutual trust and caring. The fact that intimacy in sex is never only physical. Emotional closeness is just as important an aspect of physical intimacy, one that can enhance a person's outlook on life and mental health, as well as relationships with partners. For those of you out there who know who Sophia Loren is, beautiful Italian actress, said this: sex is more than an act of pleasure. Sex is the ability to be able to feel so close to a person, so connected, so comfortable, that it's almost breathtaking to the point you feel you can't take it. Some more terms. Sexual function is a combination of physical and psychosocial factors, and that any illness or treatment that affects these factors can have a negative impact on a person's ability to or desire to engage in sexual activity. And we'll be talking about that this just in a couple more slides as well. Sexual health is the integration of the somatic, that's the sensory, body feeling, the emotional, the intellectual, and social aspects of sexual being in ways that are positively enriching and that enhance personality, communication, and love. And again, all positive, safe, and respectful. I'm going to turn this over to Shara.
All right. So I just read as it is, the path to sexual health starts with a healthy relationships. And this isn't just with a partner, but this is also with yourself, because everyone comes in from different backgrounds, from different experiences. And as we know, ALS can really affect anyone. So what we're trying to do is come up with a list for you guys that's kind of, that really applies to everybody. So there are, a lot of different things that go into this. And this is if you do not have an illness, or if you do, this is really the healthy relationship is really for all of us. So first would be respect. It's imperative to respect yourself, to respect your partner, respect wishes, respect boundaries, all of that. And that comes from creating a sense of safety and of trust. And this is not just physically when you're with someone and trusting that they're going to listen to you or not do something that's going to be uncomfortable, but also in just feeling safe to have conversations. Conversations are the key to all of this. We want to be open. We want to be able to talk to our partners, or if it's about ourselves, then we're, maybe talk to a therapist as a person, just to be able to bounce these things off of somebody else. But we want to have conversations about sex, about intimacy, about romance, outside and inside of the moments of intimacy. Humor is important. Humor is comforting to people. So it's just being open and honest and finding some humor in things. And sometimes, particularly with ALS, when there are changes to how things are going, just finding the humor in situations sometimes takes away the uncomfortableness that happens. So having a basis for all of these things, flexibility, sometimes things are ever changing, particularly with this disease, but in any relationship. And so kind of being a little bit more flexible is really important to maintaining that healthy relationship. A healthy sexual relationship can be a source of comfort. It can be a source of pleasure. It's a source of intimacy. And it's really an affirmation of ourselves, especially when other roles are changing and are taken away. So having empathy, understanding how to compromise, being positive, supportive, encouraging, this is all kind of lumped into sexuality and intimacy in a positive way. And really the key to this starts with communication. Next slide, Joya, please. So as I just said, communication is important. So, the first step to communication is reconnecting. ALS gets very much in the way of the simple day-to-day things that you do for yourself as a couple, not just in the bedroom. As we talked about, intimacy there's a lot of different ways in which we can be intimate. And it's really easy to disconnect and not think about it, or just kind of not address it, because the day-to-day we just are trying to keep up with the day-to-day. So finding those moments, short or long periods of time to kind of reconnect, acknowledge and understand things are a little bit different now. So we have to kind of work together and see how can we how can we keep things the way that they were in a sense, but also maintain that part of our relationship. And this is very much leads into sharing your fears and your worries, expressing desires, expressing cravings. We all as humans crave touch. And it is very often with this disease that touch turns into caretaking, or people just don't want, even friends don't want to touch or shake your hand when there's changes in functionality. So bringing these things up with somebody who you're close with and somebody that you're safe with is really an important thing in helping kind of figure out where things are going. Confiding in each other. Confiding in somebody really does bring you closer and may actually help lessen or resolve some of those feelings. So some questions that you can ask your partner: what are you looking for? How can we satisfy each other? How can we do this differently? What are some new things that we can try? And hopefully some of the stuff that we talk about a little bit later will give you some ideas. We want to communication, again, whether it's with a partner or with bouncing an idea off of a therapist. There are just a variety of things that can be done to kind of keep this positive outlook on things. And so, we all want to feel good. We all want to think that we're good lovers. We all want to think that we're the best and that we can please our partners in the best way, and that that's not going to change it. And we're all insecure about it. Like, that's a human nature type of thing. So being able to communicate about these topics and even just say to your partner, I still find you attractive, is really an important thing. So again, I can't stress enough the communication key is equally as important as anything else that we're going to go over today. So with that, we know that ALS does have some barriers to some of these things. So, some of these things are challenging. They make things much harder. It makes it harder to physically be intimate. It makes it harder to look at somebody in the same way that you looked at them before, from a caretaker perspective, but also from a pal's perspective. This just adds to the already swelling insecurities that we all probably have had before. So, some of these could be the hospital bed. With a hospital bed, you can't sleep together, you can't spoon, or you can, it's just a lot more difficult. But again, this is where talking about things and getting creative can be beneficial. Fasciculations occur. Sometimes that it can be a troublesome issue that happens. We know that this is part of the disease. Some people don't pay attention to it. It doesn't bother them. Some people, it really does impact them. So, having extra saliva and sometimes drooling can also be a barrier to feeling good about yourself, or maybe how your partner would look at you. And then physical equipment or physical things that are just around. We have a peg tube, we might have an NIV, a trach, a wheelchair. These are things that are barriers. And it doesn't mean that we can't work with them, but it just means that these are things that we have to kind of get a little bit more, these are some unsexy things, I guess, that we have to get a little bit more creative with. And so those being the physical things, also, as Julia stated, we know that sexual function remains the same in your physical ability, but there's a lot of things mentally that go into the, being intimate with somebody and having sex. So, there might be a decreased interest or libido. Again, there's a lot of other stressors going on. There's a lot of other things going on. Your day is busy, you get very tired. So that may decrease some of your arousal. It may decrease the ability to reach an orgasm, or just even your interest in all at trying. Fatigue, especially at the end of the day, is not an uncommon thing that can lead to a lot of other emotions, anxiety being one of them. When you're trying to feel a stressor of your partner, or just in general with this disease, there's a lot of emotions, and they are a wave of emotions, and they go up and they dip and down, and they're constantly changing. So that at any point could impact your sexual health. Cognitive changes are another thing that just changes how you're looking at things, people's interpretations of things. Communication can be affected by cognitive changes. So they all kind of swirl together. It's usually not just one specific thing. medications can help with some of these issues, but they can also have the opposite effect on your desire to be intimate. We talked about fatigue and energy conservation. They do overlap a little bit. We have the mobility and issues and some respiratory stress. We've touched on some of these a little bit before with the physical things. So all of these kind of accumulate to be what could be a big barrier, might not be, but it could be. And so hopefully some of the things that we talk about will kind of give you some ideas on how to alleviate some of these barriers. But before we get to those ideas, I do want to go to the next slide. We had some really, really good comments from some of our patients when we posed this question. So we just wanted to take a moment to share that, because I think it's really beneficial to see that something you might be thinking, other people might be thinking as well. So we're going to have them come in. So this person said, can't sleep in her hospital bed. It's way too narrow to accommodate both of us, and I miss the cuddling. I don't want to make it worse.
Yeah, sometimes people are really afraid. They're just really afraid.
Right, and to me, for that one, that could be the pal, and that could be a caregiver. You don't want to change things any more than they're already changing. This one, as my speech therapist had, I appreciated, I can't easily access my AAC device while we're trying to be intimate. I mean, if you think about intimacy, you're saying things to each other, you're talking, and when your speech is impaired, that really can be impactful. And this was something that it didn't register exactly the same way to me until I saw this quote. Too many other concerns take precedence. It is no longer a priority. This is a very common comment that we hear. Your days are busy. You have all these things to do. You have your therapies, and you come to clinic and we tell you 20 million things that we want you to do on top of everything they're already doing, and things take longer than they did before. And unfortunately, sometimes intimacy and sex just are the things that fall, off the list of things that as a priority. I don't know what to expect. I mean, that's, yeah. And we never talked about it. Again, this is why I spoke probably too long about communication, but we can't stress enough talking about it. Hugging causes too much pressure on his diaphragm, and I see him struggle. Again, the fear. We are no longer able to sleep nestled against each other because his fasciculations wake me up.
So there is no right way to be intimate, and there's no wrong way to be intimate. We have to just really redefine, reframe, what is sexuality to you, to your partner? What is intimacy? And maybe the way you had sex in the past is not the way you're going to have sex in the present or the future. The alterations in relationships that occur because of the diagnosis, the challenges with communication, responsibilities change, roles change. But again, keeping those lines of communication open, redefining your sexuality and intimacy, reprioritizing. No right way to be intimate, and there's no right way to have sex. The next few slides really talk about that, and how do you maintain, reclaim, or reinvent your sex life. And we'll be talking about the team, emotional counseling, medications, lubricants, tools, literature, Pornhub, and positioning. And so first, we think about your clinic team, the neurologist, the social worker, the nurse or the nurse practitioner, the nutritionist, the physical therapist, the respiratory therapist, the occupational therapist, the speech language therapist. There are a lot of people on your team that have expertise in a number of different ways. And we encourage you to ask questions, address your concern. Let us provide resources for you. We can suggest ways to minimize discomfort, look at some of those physical barriers, help alleviate them, or ways to work around them, and to think about your energy, your fatigue level, and some strategies that might be useful for you to save those. There's support groups that are run through the ALS Association. And I know talking to lots of the clients that come through the clinics, support groups are immensely helpful, whether they're in person or virtual, telephone support groups, really are a way to connect with other folks that are going through the same or similar, issues, and then the various therapists that I just mentioned. Emotional counseling. Emotional counseling does help to sort of reinvent your sex life, feeling better about yourself, feeling more comfortable, enabling you and facilitating ways for you and your partner to communicate with each other. Some team members might include the social worker, or the psychologist, or the psychotherapist. There's a bullet on the slide, the American Association of Sexuality Educators, Counselors, and Therapists. And on that website, there's a ton of resources for you. But I think that this middle piece here, stop comparing your current sex life to what you had in the past. Right, and that goes along with every function. Stop comparing the now to the past. Let's look at the now, see what we have, see how we can make the best of it going on into the future. This is another quote that we thought was interesting. If you can't cut meat because your hand trembles, that doesn't mean you stop eating. If you don't get exactly the sexual menu that you're used to, you have to learn to compromise and to try another recipe. And you know what? Sometimes those other recipes are damn delicious and they're even better. So we encourage that. Obviously, there's no cure for ALS, but people's discomfort can be made comfortable with different types of medications to help relieve your muscle cramps, excess salivation, and other symptoms. Who do you talk to? You talk to your primary care physician, the neurologist on the team, the specialist in ALS, the psychiatrist, the nurse practitioners. I mean, the classes of medication include antidepressants, anti-anxieties, stimulants, and that's just a few. Some suggestions, but always talk to your medical professional. Take your required pain meds 30 minutes before you have sexual activity. It's a little bit of planning, maybe less spontaneity, but if you are in pain and pain medication helps relieve that and make you more comfortable, it's worth just a little bit of pre-planning. Remember that alcohol and tobacco, marijuana can also affect your sexual functioning in different ways, right? And then to reduce or stop taking medications that have a negative impact on your sexual functions before your sexual activity. And all of those suggestions are on the advice of your physician.
Just one point to Joy, to the alcohol and tobacco, yes, certainly can have an effect, but also sometimes having a glass of alcohol or a couple sips of wine may actually calm the nerves a little bit. So that can also be looked at as a positive tool.
Yeah, positive and negative effects. Yeah.
All right, so the tools. This is what I think everyone's been waiting for. And again, to Joy said, our goal here is to teach, to give some ideas on how to maintain, reclaim, and reinvent your sex life. We can't stress that enough. So the next few things that we'll be going over are tools such as lubricants, vibrators, sex toys, playing into your sensuality, and even something as simple as flirting, something that we learned when we were preteens, we can use now. All right, so vibrators. There's no right way to use a sex toy or a vibrator. This is something that can be used for mutual stimulation. It could be used by yourself. It could be used with a partner. It could be used for self-stimulation. There really are so many options here. Technology is a wonderful thing, and there is a lot more out there than there was about 20 years ago. So there are now wearable vibrators, so something that can be affixed to your body. So if there is difficulty with hand function or mobility issues, and you are not in a relationship and you want just to be able to self-stimulate, there are some options for this. There are also wearable remote control toys. And while you might need some help getting the toys on or turning them on, many of them can stay on your body. You can use it to play alone if you want. You can use it with a partner. Pillows are good props for getting into the right position for using these toys. There are even toys that are controlled, not just remote. There are remotes that come with the toy, but there's also toys that are controlled by apps. So it can be placed on you, and somebody doesn't even have to physically be in the same room with you, or you don't have to be. Or you can do it yourself through like a Bluetooth if you have an app that controls the toy. So like I said, technology is really advanced, and there's lots of things that we can do. There are also finger or mini vibrators. These are sometimes a better option for people. They're lightweight. They can often fit on your finger. Is in your hand. It might be a little bit easier to use if you were using this individually by yourself. There are also a lot of adaptable toys, and the adaptable toys are really helpful because they reduce fatigue. So we did put a link down here, and this is I think a really great resource that talks about a lot of these things and talks about how to get them, gives some opinions on things and for whom they might work best. For example, some things that were listed on this blog were lightweight toys. So they have with like a longer flexible shaft or even a handle that can help you kind of reach areas. Really just kind of helping incorporate assistive devices into the experience with your sex toy. They even had, and we put this up here which you all can read, but they even talked about placing the vibrator inside of sponges or wrapping it with tape or something that would make handling it easier. So I do encourage you to check that blog out if you can, but again, no right way or wrong way to do this. We are just reinventing and working with the now and planning for the future. So there is literature out there, and some of this ranges from educational books. There's a couple. Here is a couple we put up here that got high reviews from people, but even something as simple as erotic books. You can read by yourself. You can read with a partner, maybe reading out loud to each other. Anything that really works for you or you and your partner to change the mood and get things going. As Joya mentioned before on our main list, we did talk about Pornhub. That again is people can do that on their own. They can do that with their partner. It really is just whatever your preference is and whatever might set the mood and kind of create the atmosphere that you're looking for. I don't think I mentioned it in the other slides, but it was on the list of tools is lubricants. And I don't think we have a specific slide for it, but lubricants can be a really helpful tool to have. And that can just be with intercourse, when you're with masturbation, when you're using the vibrators that I mentioned before. It can help just reduce discomfort. It can alter things with positioning, as Joya is going to get into shortly. Some of the medications that you take, whether it's for physical issues or if it's for emotional issues, they often have a drying effect. So this might be something that's a really easy thing to use and easily accessible.
Shara, I like how you said read a book, read to each other. Also books on tape, right? There's that as well. If you really can't like physically handle a book or read a book, that's another option.
And there's apps for, I feel repetitive saying this, there's apps for that. But
yeah.
There's like, Audible, there's tons of apps and there's tons of stuff on all of these apps.
All right, so positioning. So we're all sexual beings, and the diagnosis doesn't change that at all. We talked earlier, it's just there's bonding that goes on between you and your partner that transcends intercourse. And we know that sex is much more than an orgasm. So exploring the sensations is one way to make the bond even stronger and to make sex more enjoyable. Just to be creative, to maybe take some time to prepare. A little preparation and willingness to explore can go a long way. So the use of pillows, wedges, Velcro restraints, and other types of supports can be helpful. Minimizing weight-bearing activities or tiring movements. Practice positioning prior to engaging in sexual activity, which seems so planned, but can lead to a really nice outcome. Just giving it some thought.
Yeah, that could also be, sorry to jump in, right? That could also be part of building up to the intimacy, right? Like creating a scenario where you're role playing or practicing, and if done in the right way, can be just part of the process. It doesn't have to be so necessarily technical. Sorry, didn't mean to jump.
No, I love it. I love it. Thank you. That's awesome. Adaptive different types of orthoses or lifts or positioning devices. If you have a wheelchair, different types of positioning in your wheelchair. We have lots of wheelchairs that recline, that tilt in space with removable arms, elevating leg rests. Play around with your wheelchair. Side by side, individuals can lay on their sides with a pillow or a towel between your legs. If you have any knee or hip contractures, spoon entry from behind works well. Sometimes if you can't straighten out your legs due to spasticity or contractures, if you're on your back, your partner's on your top, you could support your legs with different pillows underneath your knees or your ankles. You can lean on bent knees. Let's see, using a wedge to support your upper body while you're sitting in a seated position. Wedges also help intimacy by promoting face-to-face during sexual activity, if that's your thing. If not, that's okay too. And pillows, wedges, all of these supports, Velcro, etc., really help discover new erogenous zones that perhaps you never knew about before, or you're rediscovering them. Spasticity is an issue for some folks that have ALS. Spasticity, sometimes, like we talk about, increased muscle tone. Sometimes it can be triggered by sex, but when you're when you're engaging in sexual activity, or it can be an ongoing thing where you have spasticity throughout the day. But sometimes people feel embarrassed or frustrated, but spasticity certainly can be challenging. So some techniques that work for people, and not all the techniques work for everybody. Sometimes gentle stretching of the affected or the tight muscle prior to positioning is sufficient enough. And that certainly can be incorporated into foreplay. Positioning a pillow or a wedge under, like, say, somebody's pelvis or legs, for example, can minimize the stretch on a spastic muscle and allow for more comfortable positioning. Believe it or not, sometimes proper hydration really has an effect on spasticity. Some people really respond to warmth, or warm baths, or whirlpool, or heating pads. Of course, making sure that it's not too hot and the skin is safe, but sometimes it's the opposite. And icing or prolonged icing, just to gather some ice cubes or an ice cold pack, and just sort of either rubbing it on the affected muscle or prolong, again, safety to the skin, thinking about that. But the use of cold or hot packs is sometimes helpful. Sometimes a vibrator helps with spasticity. Just putting the vibrator or vibration on the belly of the muscle, sometimes it's on either end of the long end of the muscle, could help as well, while stretching or while putting some ice or cold on it. Weight bearing sometimes helps spasticity, if that's possible. Just putting some weight on extremities or your trunk, your legs, Sometimes the splints that we're recommending or braces, wearing them before or during can be helpful in maintaining a more relaxed muscle tone. Relaxation strategies before sex, during sex, really doing visual imaging, tightening and relaxing muscle in muscle groups, working your way, let's say from your toes to your head. Putting on some nice soft music, anything that sort of helps bring about this nice deep breathing, different kind of nostril breathing, yoga techniques, again, stretching. But when all of these kind of non-invasive strategies are not sufficient, there are pharmacological methods that can be considered, and that you would talk to your physician about. Things like baclofen, diazepam, Klonopin, Neurontin, or injections of Botox, right? A lot of the patients that we work with their physician to look at some of the medications. So we have these non-invasive strategies that you should really try and experiment with. Again, they could be part of foreplay. They could be part of the intimacy, the sexual act itself. And then if all else fails, there's the medication.
And so we've given you guys a lot of technical suggestions, and this kind of all plays into what we've been talking about. And even with some of the technical things, the stretching, the practice positioning, the pre-planning, as you see here, it's about the environment and kind of setting the stage and making this fun and games. Everything that we do on a day-to-day basis with this disease sometimes becomes a chore. And so sometimes even positioning can become a chore. So when we're doing it in this kind of setting, you want to really go into an environment where you're comfortable with yourself or with your partner and with your environment. Set up a scenario where you're laughing, because sometimes the positions you try are not going to work. And sometimes you're going to be like, I didn't think that was going to work, and all of a sudden it does. But if you and your partner can talk about what you do and don't like and be honest about it, going back to the communication we talked about, and just make it fun, make it a game, and laugh. If something doesn't work, laughing about it is the best way to kind of ease the tension of like, oh, that was not our best plan. Let's think for next time, how can we do this better? To that point, as we said before, it's a very busy day with a lot of things on your schedule. There's sometimes a lot of people around during your day. It sounds silly, but you really want to set aside alone time. Book an appointment. Right? Like if you have it in your calendar, you're like, okay, we're going to do this. We're not going to stray. Like this is an appointment and we have to follow it. Where you won't be interrupted by families or home health aides or the kids or anything else. But it's really important to take that alone time, either with yourself or with your partner, and take care of yourself. Sometimes there are things that we can do to the environment. So there might be candles or music, or as Joy was mentioning before, with the visualization and yoga, meditation, that you can do by yourself, or you could do with a partner, just to kind of calm yourself down. Some of that is the mental and sensory stimulation. So use sights and sounds and smells and tastes and all of this kind of stuff. So if you have, back to what Joy was mentioning with the spasticity, where maybe soaking in a hot bath, take that, use that, create that situation. If ice is something that is helpful, being iced with an ice pack, make that into something fun, make it into a game. Role playing, S&M, there are tons of things that you can do, but I think the point of what we're trying to tell everybody is that you really have to just get creative, play around with things, like things that you think wouldn't work, and things that you think would work, or just not going the way you thought it would. And that's part of the experience with your partner. And back to what we said before, there's just no right or wrong way of what to do. As long as you yourself or you and your partner are comfortable and feel safe in the situation, that is really the bottom line. So with that, we threw a ton of information at you. I hope you guys have some questions for us. Feel free, as Sue said earlier, to just type your questions into the chat, and she we will try to answer as best we can.
Absolutely. Definitely put your questions or comments into the Q&A on Zoom.
You know, one thing that stands out for me as we were talking is the communication, you know, really thinking about your own needs, whether you're the person with ALS or the partner of the person with ALS. What are your needs? Being able to talk about them freely, not only, you know, to have honest conversations with yourself, but with your partner, and really think about the team as resources. You know, we have lots of things that we can offer, things that we talked about on these slides, as well as probably some other things that maybe we have never thought about before, but we can certainly help problem solve through. The idea is that we talked about the research in the very beginning of this lecture, that it's really important for overall health and well-being. If you are a person who likes sex, if you're a person who enjoys intimacy, if you're a person who likes sexual activity, don't deny it to yourself or to your partner just because of the diagnosis of ALS. Right?
Sure, we do have a question.
Sure.
You said that in the clinics, you bring up changes in sex and sexuality. Do you find that patients and partners are likely to respond?
I think it varies, and this is true to just people in general. Some people are more open about things. Some people want to ask questions and want to learn things. We try to include it in our overall care in our clinic. I can't speak to other clinics and how they do it, but you know, our goal is to help with every aspect of your life in managing the changes that occur with this disease. And some people want to talk to us about it, and some people don't. You know, as Joya said before, to consider your team as your resource, just like you would. Oh, do you have a suggestion for a neck brace, or do you have a suggestion for a cushion? People talk about these things with us, so we might have suggestions. Oh, you know, somebody told me about this, and we couldn't put everything that we know into the slides, of course, but just there's a lot of information out there, and if you're just open enough to ask about it, we are absolutely willing, clearly, to talk about it.
It shouldn't be different from any other question, I guess.
Yeah.
Right?
That's the hope.
That's the hope, yeah. So we have a couple more. What were the meds to stay away from before sex?
I think that is a discussion that you speak to your physician about.
And another, as a provider,
you know, I'm so sorry, I just want to felt like, for example, not a specific medication, but just as an example, if you take a medication that makes you sleepy and drowsy, that's a conversation to have with your doctor. You know, this medication is important. I need to take it. Is there a way maybe I can modify my schedule to take this medication? You know, or if not, then that's important information. Then you're going to, again, pre-planning, you're going to have your sexual sessions at a time when maybe, just to keep using the same example, the medication, the effect of drowsiness that you have from this particular medication won't be so significant. I'm sorry, Sue, did you have another question?
Yes. As a provider, how to handle the presence of children, even adult children, at clinic visits when you want to ask about this?
So generally with most of the topics that we talk about, we, at least in our clinic, again, we can just speak for what we do here, we're very mindful to ask if there are topics that want to be discussed in confidence and alone. And that could be with the therapist, that's with the doctor, it doesn't really matter. But sexuality, intimacy are some topics that people choose to speak about on their own without even their partners. They might not want their partner present. They may have some emotions and things that they want to talk about and as do caregivers. So there's always the opportunity, at least in how we work, where any of those topics can be, and it's not just sexuality and intimacy, there's many other that I can think of, that we always give our patients the chance to talk about things solely with us or with the doctor, if they choose to.
Yeah, I'd like to
try
add
to do it in a respectful way.
Yeah, and I'd also like to add to that, if the clinic or people on the clinic team are not bringing that up to you, they're not bringing it out to the forefront. Do you want some alone time? As an example, I think we all strongly encourage you to either maybe email ahead, if that's possible, send a little note to the team, anybody on that team, just to get that sort of point across that, my family members are coming, adult children, significant other, partner, and I just really need to have some time alone with the team members, and certainly any team would honor that for sure.
I agree with that 100%, and any topic, truly, not just this topic.
And I think a lot of our patients actually email questions, right? So that's another mode of communication, emailing a question, going back and forth with the team members that way, or certainly in advance of the visit, just so that, everyone's on the same page. They're alerted to the fact that you have this point of discussion, and there's some room during the visit set aside for that.
It also, to add to that, Joy, it also allows for us to maybe have some answers for you at the visit versus first hearing the question for the first time and not having any resources to give you. We can be a little bit more prepared for when we do see you. Yeah.
And that was a great question, because so many times, right, the person with ALS is accompanied by their adult children. Who wants to have that conversation? Or their partner, and maybe you're not interested in, or maybe you have a different partner. I don't know, but that's the point.
Yeah.
So it looks like we've come to the end of our session. Went so quickly. Just want to remind everybody to please stay connected with our chapter. We're here to help you. And if you have questions, maybe even additional questions that you'd like to add from this session, email us at als@als-ny.org. And just a comment, in closing, as a professional, like listening to you, I think it's really going to help me to talk more with patients in clinics and in other venues because just listening to you in your cool, calm, and collected way about it, this subject that can be so, I was going to say touchy, so I guess I'll just say it. It's just been great to hear the way you approach it, and
thank you.
And staying in the now was great too. So thank you so very, very much, and thanks everybody for coming.
Thank you. Thank you for attending our presentation. Thank you very much.
Thanks, everyone.
Bye for now.